Chemotherapy began in 1946 when the Department of Defense funded Dr. Goodman and Gilman at Yale University, a very eminent pharmacologist who wrote the classic textbook on pharmacology, to find a medical use for mustard gas. So they did some laboratory experiments, and they just found, I mean, they were told to do it, they did it, they were funded, and in rats they could reverse tumors using mustard gas, which is, of course, used in war as a poison. And then they tried it on a single lymphoma patient who had advanced disease, and all his tumors regressed. And he did die within a couple months, but no one had ever seen tumors in a cancer patient regress with a drug, and that started the whole chemo regimen. But because of that extraordinary response in a single patient that lasted a few weeks, the entire chemo industry came into fruition. Drug companies loved it because you could patent these things. In natural treatments, you can't patent. So cancer just there was a fork in the road. It could have gone toward natural treatments. It could have gone toward synthetic, and they chose to go with the synthetic drugs based on one patient. Now, interestingly enough, right about that time, around 1946, Dr. Gerson, who had his own nutritional protocol long before Kelly, had presented cases to Congress of cured cancer patients with a nutritional therapy. And there are actually hearings on Gerson's work, and I have the reports from those. But when the single patient responded, they forgot about Gerson and the nutritional and alternative. It all went toward chemotherapy.
97% of the time, chemotherapy does not work. 97% of the time, it doesn't work. So why is it still used? It's one reason and one reason only: money. Period. It doesn't work 97% of the time.
Dr. Tutu Simoncini, oncologist himself in Rome, Italy, stated that the medical profession has a cancer cure rate of 2%. In my experience and a lot of colleagues, 27% of all people that have cancer and do nothing get cured. John D. Rockefeller, the one that made the big money originally, he created the curriculum for the entire medical education in the world. And he made sure that only the chemicals he produced are used for the treatment of illness, no matter what it is. They don't go for the root cause, they don't look for the root cause, they have never learned about curing anything. And they are a pseudoscience. Basically, the medical profession is a religion. And it goes, their premise is, the idea behind all of this is, if you have a garden with flowers and bushes and trees and grass and some weeds, you come with Agent Orange and you kill it all off. And now it's all dead. And now you hope only the good stuff comes back, the flowers and the trees and the bushes, and the weeds will not. What's usually coming back, and it's the only thing that's coming back are the weeds. And the same is with cancer.
In everything I've seen, in all the autopsies I've done, and I've done several, like more than I can count, of cancer patients, not one of them died of cancer. Quote, cancer. They died of liver failure. They died of cardiac failure, renal failure, all due to chemotherapy.